Hey everyone, Amy Wood with Dr. Cedrek McFadden. He's our 7 News medical consultant. The voting is getting ready to happen. There's a lot of absentee voting going on right now, but there's also going to be voting day that's coming up next Tuesday. And Dr. C is here to talk a little bit about how to vote and stay healthy and safe in the process. How much risk is involved, Dr. C, in voting during a pandemic?
Well, this risk is important to assess because many people are concerned, especially people who are in the highest hit impact groups. We're talking the Latinos, Black populations, very concerned about it because they've been hit much harder than others. In particular, if you think about the risk of in-person voting, it's about the same as going to the shopping market. In both of those instances, you're waiting on a line around other people. And in both of those instances, you're waiting to perhaps interact with someone and touch frequently used objects. So just as you would when you go shopping, we have to put certain safeguards in place to keep that risk at minimal and to stay safe.
And explain, the work to get ready to make voting as safe as possible didn't just start a couple of weeks ago. I mean, they've been working on this, trying to make it safe for months.
Correct. The more people we are around and the longer we're around these people, that increases risk of COVID-19. And you can imagine isolating everybody or funneling everyone to one voting day with longer lines, larger crowds, that risk would be great. So as early as June, the CDC released some recommendations that we're starting to see even now, discussing things that we can do to reduce some of those risks. So they've talked about obviously keeping voting machines spaced appropriately, perhaps having some barriers. They've also talked about making sure people in line are spaced appropriately, having separate entrance and exit doors. They've also made sure that poll workers have the equipment that they need so that they are safe. There's also been a push to recruit younger poll workers, as we know that many of the older poll workers may be at higher risk. So a lot of these things have happened months and months before now. We're obviously seeing now that we're in voting season.
So what about the high-risk voter? What do they need to particularly pay attention to?
Well, we're talking about people who have those chronic medical illnesses or people who live with people who have these chronic illnesses, such as cancer, diabetes, heart disease, lung disease, to be particularly careful that they're not exposing themselves to risk and having future problems with COVID-19. In these cases, we have to consider, obviously, the use of mail voting and also using curbside voting when possible. If you have a voter form that you're going to be potentially trying to deliver in person, in some cases you can actually have, in most states, you can have someone else deliver that as long as the proper documentation is done prior to the delivery of that voting registration form.
And when we do head to the polls, what do we need to bring with us? What do we need to be prepared to have with us?
So before you go, you definitely want to remember to bring your mask. You also want to remember, especially if you're going to be in line for long periods of time, you're going to be going through doors, you'll be touching things that are frequently touched, consider bringing an alcohol-based hand sanitizer with at least 60% alcohol. You want to use this before you vote. You also want to consider you bringing in like Kleenex. If you're going to be sneezing, coughing, you want to be able to use those items and then placing them in the appropriate trash disposal units. And finally, you want to consider bringing pens or styluses that you can use during the vote so you're not having to share and use things that other people used.
And what do we do in terms of getting there and making sure we're safe in the voting experience? So in other words, I've seen some video online of people being definitely not 6 feet apart. I mean, should we be trying to ask people to stay back from us? Is that important?
Well, that's certainly an option, and really just modeling that behavior that you want to see displayed around you. But if possible, consider waiting in your car until you can see that the lines are getting shorter, going at a time that may be less amount of traffic, perhaps in the mid-morning. But monitoring is a great way to keep yourself out of a long line around other people. But when you get there, you have your hand sanitizer, you're going to use that. If you're going to be using those hand sanitizers, don't expect to be able to clean your voting machine with those products because that obviously can perhaps impact the machine itself. So, having your hands clean, having them dry will be certainly useful. If you're bringing a pen that you're going to use your own or even a stylus that you want to use for the machine, ask the poll workers whether or not that's allowed, making sure it's going to read your vote. You definitely want to make sure that your votes are being counted. But again, modeling the behaviors that you want to see and definitely consider traveling alone. This is probably not something that you want to bring all your children to, having them exposed while you're waiting. And that can be helpful as well, keeping you and your family safe when this voting season continues.
Dr. Cedrek McFadden, thank you so much for your voting advice. We appreciate it.
Thank you.